Hi guys, this is Stuart Blackwood Vascular. I'm coming to you from my house with my videographer and professional here. And today we're going to be talking about the challenges with vein disease. These are educational videos. These are just my opinion. This is how I take care of my patients. This is not medical advice. So if you need medical advice, you go and see your own physician. Either a vascular surgeon is what I would recommend if you have vein disease, as we take care of the full gamut of vein disease, but also any professional really who has been doing it for several years in any other specialty, who is well trained in America, will be able to do a good job for you, and who is ethical. So in that case, once that said, I wanted to explain to you sort of the algorithm of American treatment of vein disease and where we all have a challenge. The patients have certain expectations and goals, the insurance companies, and everything else involved. So this is just a brief primer showing you this in my sort of opinion on this. But essentially, can you go ahead and hold the camera still for me? This is a Venn diagram, and here we have the patient, what the patient wants, patient desires. So patients come in with things like, they come in and they say they have pain and they want the pain gone. They come in and they say they have pain and they just want the pain improved. They may have cosmetic issues. They may have like spider veins and stuff like that, and they want that gone. They may have cosmetic plus pain. They may have just heaviness or swelling. It may be that their wife told them to come and visit the doctor. Or their friends at the, I have a lot of guys who show up and they're, tradesmen, and they show up and, a bunch of buddies saw them on the ladder and saw they're in the summertime and the big bulging veins, and they say, oh, you got to go see a doctor for that. So what the patients actually want, and maybe they just want reassurance that this is okay and they're not going to die. So this is the patient desires, and that's one part of it, right? Now here is where I stand. Let's put me in blue. So this is the physician training and comfort plus physician kind of thought process of what we should do. So as a physician, I might say these patients over here, probably I would not feel comfortable treating them because I don't think they have enough. They either have vein disease, maybe they have a spinal problem, and that's why they're having the pain in their legs. Can you hold the camera still for me, please, buddy? Or maybe they have a spinal problem, or maybe they have something else going on, right? This is not necessarily varicose vein disease, and these patients do not necessarily need any treatment. There might be these patients in the center here who might have both varicose vein disease, and the patient kind of wants something fitting to what I want or what I feel comfortable treating. Some patients might want, let's say the patient has varicose vein disease, true varicose vein disease with pain and other symptoms, heaviness, swelling, achiness, tenderness, but they want something that's unreasonable. Well, this would put them in this category. Alternatively, you could have a physician who feels comfortable doing a vein stripping, but the patient does not want a vein stripping, or a physician who wants to do a procedure such as any procedure really that requires that could be done in the office with just local anesthesia. Many of these procedures can be done that way, but you may have a patient who is so terrified of any sort of needle puncture or anything, and they will not tolerate that office procedure. And so for those reasons, the patient desires and the physician's training and comfort has to sort of overlap. And I would say what I'm going to lump into physician's training and comfort also goes with hospital. And actually, I'll make this into a different Venn diagram circle. I'm going to put hospital and tools, right? So I'm going to put this here as tools available in facility or community. Obviously, every hospital has different tools available. Some hospitals have RFA, which is a heat-based way to treat the great saphenous vein. Other hospitals have only laser. Some procedures, some facilities have sclerotherapy. Some of them have certain types of sclerotherapy. Some of them don't have all of them. So, for example, varithena might be more expensive. Every hospital cannot afford that. And if you're in rural medicine, you might only have sodium tetradecyl sulfate, which is just basically, or even worse, even just hypertonic saline, which is just really high concentration salt water. You have detergent options that you can inject, but they're different prices. And then here comes another tricky part. Sorry, videographer, you can't put your fingers there. So the other part here that's tricky, and I'm going to put that in. So here we have a patient still being able to be treated. You have the tools. We have all the medical things we need. The physician is trained and feels comfortable with doing this procedure. The patient also still is meeting, still is in agreement, and so this is still good. And then guess what else comes into the picture now? One more thing, and really probably one of the most important things, and that is right here. I'm going to put in another circle, and that is the science. Is the science supporting this surgical procedure? And so now look at where we are. All we have left is this little circle here in the middle. And so all the other patients are either going to get treatment and leaving someone unfulfilled, or meaning, like, if I was a physician doing a procedure outside of my comfort zone, sometimes we do this, but we really should not be doing this. That's not good medical care. Other times we're doing procedures that the patients don't want. So you really should try to match all of these things up and have it right here in the middle. And that's why so many people go to physicians for everything, really. This is not just veins. And it doesn't always work out that you're going to get a procedure. It doesn't always work out that once you get a procedure or a diagnostic test, that you're actually going to feel better after that procedure. And oh my goodness, let's throw the biggest problem now of all of this. Let's throw the biggest monkey wrench into everything here. Then we now go to a country called America, and we throw something called an insurance company. Money. A good old free capital market. And so now we have a problem. Insurance will not pay for any of this stuff over here. So all this stuff that you thought was good, the insurance company will not cover. So now you only have this option. This is the final treatment plan. And what's worse, if you think that that's good enough still, if you still think that's some good enough part of the population, this can look very different in one community compared to another. If I am working in the hospital and I have good insurance because I'm a nurse or a physician, and I actually can get treated, my insurance company might look more like this. So I might be able to get varithena or RFA. I might be able to get treated for both my accessory veins and my saphenous veins at the same time. I might be able to get it after a certain amount of time, the treatment performed. Whereas if you were working with some other company, Medicare or Medicaid, actually Medicare and Medicaid are pretty good, but some other insurance companies are very limited in terms of what they will cover. And every year, the payers, the people who pay all of these bills, the insurance companies and the patient themselves, are finding it harder and harder to cover these things for whatever reason, maybe, right? Whether it's you know just general life and inflation, or whether it's just a greed or a need to make more money. Um, so this could be one insurance company. This could be another insurance company. This could be another insurance company over here. There might be even insurance companies over here where it doesn't even come close to meeting the requirements of what the patient and the physician and the hospital can actually do in the community. And so that's why we have such a disparity in America in terms of how we manage our vein patients. And this is very important because this is not like aortic aneurysm work where patient desires and more or less you know the all of these circles are actually much tighter together. In the case of aortic aneurysm, there's all these circles still exist, but they're much tighter together. So the circles might look something more like this. Patient has a 7 centimeter aneurysm that needs to be repaired. There's the physician training. Here is the tools available. And when I say tools, I mean the basic tools, meaning like you can do a open aorta or endovascular aorta in most centers. The patient desires is either to get it fixed or not fixed, and then the science behind it is backing it up, right? And the insurance companies are usually covering, right? So it might even be that all these circles are right on top of each other, and I don't know, maybe an aortic expert could actually look at this video and say, this is actually not true. We're having a worse problem than veins, and kind of push back on this. But I don't know. This is just my feeling, my opinion. But I definitely know that there's a challenge here in terms of how these four different things kind of line up within healthcare. So that's my little spiel this morning about veins and how to, if you're a patient coming in to see a physician, why it actually is not just so simple as I have a varicose vein or I have a spider vein, I'm going to get this treated. So, just to wrap up, vein disease does not live in a vacuum, guys. It sits right at the crossroads of insurance rules, patient preferences, real science, physician training, and the resources available in your community and your hospital. Once you understand how all of these pieces fit together, you can actually start to make clearer, safer decisions about your own care. And if you want to keep learning how the system really works, then or if you want to learn more about your family member's vascular disease, follow along with me this year, Blackwood Vascular .com. Email me at blackwoodvascular@gmail.com if you have any questions or comments.